Our guest today is Dr. Talina Hermann, an acupuncturist, herbalist, functional medicine practitioner. Just started a practice or clinic in Montecito.
Montecito Wellness.
Montecito Wellness. This is a little different for us. These are more Eastern techniques of treatment, of evaluation and treatment they use that I've always found very fascinating and things that I can learn from.
Yeah. And something about you, Duncan, is you, from the moment I met you, you are so open to the way other people practice medicine, Eastern, Western, holistic, all of it. And so it was great to see the two of you chatting.
Well, thanks. I appreciate you recognizing that because that's what I feel I do, and I want to do.
You really embrace it all, and that is super unique, and I love that about you.
I think you'll enjoy this podcast.
Yeah, enjoy the show.
But what do I know? I'm just a vagina doctor. Dr. Talina Hermann, welcome to the Vagina Doctor podcast.
Thank you, and thank you for having me. Really
Pleasure.
excited to be
Good.
here.
Karen Spaulding's with us today. For the listeners that can't actually see her here, she is my right hand. She finds guests for us. She asks questions. She keeps us on the straight and narrow if we get too technical.
Okay.
And she runs the show. So
Thank you, Karen.
that's the other word in there. So you're an acupuncturist, herbalist, functional medicine practitioner, recently opened the Montecito Wellness Clinic.
Correct, yes.
Tell us about it, and your associates for that matter, too.
Yes, so Montecito Wellness Clinic has been a long-term vision of mine. When I went back to study medicine, holistic medicine, this was my end goal, which, and we'll talk about it in a second, turned out to be just the beginning of the next journey, as you know. I wanted to offer a holistic space that holds space for women and their loved ones to dive deeper into their root causes and educate them and help them learn the tools that they can implement at home to live healthier, happier, more balanced lives and optimize their well-being. Yeah.
And give us an example or a few examples of the types of patients that come to see you. What are they asking for? What are they? I'm sure there's a large variety of reasons for that,
Yeah.
but describe some of your patient interactions.
So our patients are quite similar, actually. It's the age is usually between 35 to up to early 50s, who comes in. They're overall very healthy people, actually, already healthy. Their standard labs don't show anything wrong with them, and but they don't feel 100%. They're still anxious, depressed, or have some gut issues that they've tried taking out, elimination diet. It's not working. They're gaining weight, but they're doing everything right. They're on this transition, and this is where we come in. We sit down and we go deep. We have a very in-depth intake form. Then we take a long time to talk about everything. And then based on that, we come up with a treatment protocol. And that's when personalized medicine for us, that's when it comes into picture. We either prescribe, usually we do advanced testing. We'll look at their guts and see what's happening. We'll look at their hormones if needed.
What gut testing do you do?
We do GI map, which gives us a lot of information.
What is that?
GI map, it's a stool analysis map.
Okay.
And we look at inflammation markers. I also add zonal into it, which helps you take a look if there's gluten sensitivity possible. If there is, you have to go on and continue testing.
Okay.
You will look at the gut, gut permeability. Sorry, leaky gut
Leaky gut,
issues,
right.
right? If there are any opportunistic overgrowth pathogens, H. pylori. We'll look at it gives us like a nice little roadmap of where the patient is. And also a lot of times, there's an overgrowth of good commensal bacteria, right? And it's out of balance because there's something else going on. And is their gut immunity intact, right? So it just truly gives us a wonderful picture to start with.
And where is there a local lab that is doing that for you, or do you send it out?
We send it out. We work with Rupa Health, which sends it all our tests.
What's that?
It's called Rupa Health.
Rupa Health.
Yes.
Okay.
They work with a lot of functional medicine practitioners. Mm-hmm. They send all the tests that we order directly to the patient with instructions and everything. So we outsource that, right? And tests come into us, and we go from there. Yeah. And based on that, go ahead.
Oh, no, I was just but you were going to, I think, go to what I was going to say. So based on that, we come up with a treatment protocol, which is personalized and unique to that particular person. And it could be diet modification. It could be smart supplementation, botanical, herbal medicine. And of course, gut, I don't know if GI map is based on 5 R's, right? There are 5 different stages. So this is not a magic pill, and I have to make sure patients recognize that this is a partnership, right? This is not just like, here's a pill for you and it's going to fix your things. No, now we're going to go through different stages of this protocol. It's remove, reinoculate, rebalance, the rebalance would be the last stage of the protocol because you introduce and you're changing the tools, and with patients, you're completely changing their lifestyle. And then do you test them again?
And we retest. It depends. 3 to 6 months is usually when recommended. Let's say a patient has low CGA levels, right? That takes up to 6 months to a year.
And what is
raise.
that?
So it's an inflammation marker, but if it's on the low side, that means patient might have leaky gut, patient have immune system, low, weak immune system, possibly some food sensitivities. And that is, then we decide, do we go and test for food sensitivity? So we never do the other way around. So that particular biomarker takes a long time to increase, because it's stress levels.
Right.
You have to completely change your life, change your stress management, your diet. You have to cook at home. It's like a very particular patient that is ready and willing to do that.
Are patients coming to you? Are the patients coming to you, like you said, sometimes they're not sick, they're actually healthy, but they want to just take a deeper dive, right?
Deeper dive, they want to optimize their well-being. And, females are so wise, right? There's a reason why 100% of my practice are all females, because they come in and let's say they're like, okay, I'm 38 and I'm starting to feel small changes and I want to kind of get ahead of this. What's happening? I need to, figure out what's going on. And that's where we come in.
Are you saying that males aren't smart enough to do that?
Males I adore males, I'm married to one, but you guys come in, you're like, okay, this hurts. Can you fix it? And we fix it, and that's it.
Right?
Yes, and we're here for it as well. Usually we end up treating, the husbands who come in begrudgingly, and they're very welcome. But females, they are on board with the idea of prevention medicine and taking good care of themselves now to avoid problems down the road.
Quick question. I hope a quick question. We hear a lot about gluten sensitivity now. And, from medical school, you either were gluten sensitive or you had celiac disease or you didn't. There wasn't, and if And if the patients with celiac disease had anything with gluten in it, they got very, very sick.
Yeah.
So it was really black and white, or at least that's what we were taught at the time.
Yeah.
It seems like either we were wrong then, which is quite likely, or there are, and I should say, and there are various stages or amounts of gluten sensitivity as opposed to it being black and white.
Yeah.
What's your thought about that?
Well, I think it appears that everybody has some kind of sensitivity according to the GI map test that we do.
Okay.
In order to confirm it, you would have to do further testing. But people feel so much better when they take it out of their diet, just even to feel, better energetically. Energy levels increase, they sleep better, their mood increases. So even though we're not confirming with biomarkers that they're celiac, right? Or they're definitely they have sensitivities, and any kind of food sensitivities, right? They're so tricky to diagnose because it takes up to 72 hours to figure out what you for the sensitivities to show up, right? The response. So you have to go back and figure out, what did you eat? And you ate so many foods. So when you take out this, like the biggest offenders, just people feel better, much better. I don't know if I answered your question,
you did. No,
but
no.
a lot of people just feel so much better taking it out. It's also, goes back to our food supply and the way we process everything.
It's too. It could be just pick up your mic and put it a little bit higher.
Okay.
There you go.
Is it better?
Yeah, that's way better.
Okay.
Perfect.
Okay.
Got
I
you
can
now.
hear myself just fine.
No, I know.
I
I know.
can
It's awkward with the mic,
it is.
but
Yeah,
you got it. You're perfect right now.
Okay. Thank
Because you have
Appreciate
an amazing voice.
Oh, thank you.
But so we couldn't hear the full octave of it. So
Okay.
the thing about gluten and the gluten sensitivity, that's or whether you have it or not, or it could not even be about the gluten. It could just be about the carbohydrate itself,
the protein,
and how your body works it all out. And if it doesn't, or if it does, okay. But I think that people saying, "Oh, I can't eat gluten," it's maybe not the gluten. It's the other part. It's like people with wine saying, "Oh, I can't." Oh, the what's it called? The tannin. Yeah, I can't do the tannin. A lot of times it's not the tannin. It's the herbicides, fungicides, and pesticides in the bottle of wine that you're responding to. So it's always hard to identify that. What food testing do you do? What test?
MRT. It does MRT Oxford lip test, and it does give you a beautiful breakdown of foods where you're to avoid, right? It comes with this chart, color chart. Red is to avoid, and goes kind of down the, which ones you can tolerate but shouldn't be having, really. And you can create we call it bio-individual nutrition, right? And you can really then say, okay, well, this is what works for you. If it doesn't, and the patient has the copy of it, and they are fully on board when they see what makes them feel.
And is that a blood test or a stool test?
It's a blood test. Okay. Yeah.
That's the one I did.
Oh, did you?
Yeah.
How was it for you?
It was good. It's so interesting what it said. But then,
were you surprised by certain
some of it was like, oh, well, yeah, that makes total sense. That seafood is something on there that I shouldn't be eating ever, right? But I do from time to time. But all seafood was on there. So
that's a hard one, right?
I know. And almonds. So even if I was doing almond milk, you know what I mean?
Yeah,
like
you would be trying to be super healthy,
right,
by making your own almond milk.
Yeah. And then it's on the list as highly reactive, so stay away from almonds.
So when you took it out, did you feel better? Did you see the difference?
I would say that I put it all together. That makes sense. And I didn't eat a lot of almonds, so it wasn't really anything. And then seafood, like I said, I do eat from time to time because he likes seafood, and
seafood is healthy for you, right?
Yeah, exactly.
And it's a great alternative. Protein is important.
It's
for
longevity. It's upsetting actually that I'm allergic to it, or not allergic, but sensitive to it.
Sorry.
But yeah, so I think that's
yeah.
a great test. And then they give you that little card too that you can just, it's
Yeah.
easy. You don't
Yeah.
have to,
Oh, I'm
So that's a
glad.
great test.
So you talked about an example of a patient who was
Yeah.
late 30s,
Mhm.
and the age span that you're working with is that up to 50, 55, something like that.
So probably
That's
more early 50s.
early
Because
50s.
from that, go ahead.
Okay,
We'll go from there.
which is a radical change, usually milestone of hormonal variation. How much of, I mean, if for this patient that you described that is just not feeling very well, not sleeping very well, do you check hormones at that time?
We check hormones at that time, and we also right away do acupuncture treatments. So, because acupuncture is amazing, with been proven to help female issues and sleep and calm down nervous system and endocrine system and HPA axis. It regulates pretty much every system in the body. So while we're waiting for the hormone test, we are working on it right away on balancing a human back into her center. That's
Is it
my
saliva
approach.
or blood?
We do Dutch test, which is dried urine test. But it's, that one is an amazing test. You get a lot of information out of it, but it has to be done a certain time of the month. And, that takes a little while for the patient. That's probably the most challenging task for the patients to complete.
And it's dried urine?
Dried urine test. So you do it over the cycle of 24 hours. And there's certain foods you can eat, and because it also checks for your adrenal health.
Wow.
Yeah,
That's
pretty
great.
So it's a good test to just kind of see where you're at.
I've been aware of that.
But
I've never used it.
No.
But it's a good thought, because the patients in that perimenopausal area or premenopausal area are often very hard to diagnose and very hard to treat.
Yeah.
When they get into menopause, as I was saying to you on the phone the other day, it's easy.
Yeah.
It's we'll replace and balance and do the work there. So, but let's go into hormones a little bit. So you test them with that test.
We test them with the hormones, and then we'll look at where the levels are. And my biggest focus is on an adrenal health. Make sure their cortisol levels, right, waking cycle is on track where they should be. And also, I see a lot of estrogen pathway detoxification pathways that are not necessarily safe for a female. And that's how we can correct it with supplements and nutrition, because we see it early enough before it is a risk factor, let's say, for all these diagnosable diseases down the road. But it's early enough that when we correct it in the body, we balance it holistically.
What's the problem with estrogen at that point? What's going wrong?
A lot of females, not a lot, but a lot of patients we see, there are 3 different estrogen pathway detoxifications, and one of them is the safest one, right? And the other 2 are kind of like a backup pathways. And quite a few times we see that there's this pathway that is preferred by the body to detoxify, right? And we want to make sure to enhance the safe pathway of a female, so estrogen gets detoxified through that pathway in order for her not to hold on to the extra hormones in her body. And then, what happens is we see inflammation, we see depression and anxiety, we see weight irregularities. That kind of like tells us of that things are probably not flowing as they should.
Yeah.
And how do you correct that?
Yeah.
So we use supplements, we use nutrition, and we do that for a few months. Let's say we like kind of like 90 days, to see, and then we retest. And there have been positive results, and which is incredible, right? But this is where we're talking about a female in her late 30th, early 40s. So it would be a different approach for a female who is starting to get into menopause.
Okay.
This is where we come in, where our practice is, is really helpful in that stage.
And what diet are you recommending for people in that, going through that?
Usually, of course, cruciferous veggies, but then you have to take a look at their thyroid health, right? And are they on any kind of thyroid medication? There are supplements that you can take, and they're all, natural supplements that you take and help body to detoxify, and and of course, glutathione is there, and neem, and
do you do just glutathione oral, or do you do any injections?
We don't do injections yet. We do oral. Liposomal is like my preferred way how we recommend it.
I heard the yet in there. What are you going to be giving?
Well, we have a couple of things. Yes. End of the year, we have a couple more things planning.
Right.
So one step at a time. We're kind of seeing what our patients
are asking for,
and utilizing that feedback, and then we're here to support our community as you are.
Yeah.
And do you work together with your colleagues there at Montecito Wellness? Does the plan, do they start at one place and then work with somebody else in your practice, or are they separate practices?
As of right now, we work together. We have an amazing team. We have 2 holistic psychotherapists. We have a breathwork practitioner and an acupuncturist. So I'm so grateful to be able to share that space with such incredible humans. Later this year, we're doing programs that are going to be a commitment program for 8 to 12 weeks, and it's going to be supported by the whole team. Because people get stuck at certain points of their wellness journey, and sometimes need just a little help and support to get them to that next point. Yeah.
That's great.
And thyroid, that was another subject that came up in our conversation, and actually just now you mentioned it again.
Yeah.
Thyroid, just the control of the metabolic rate of the body.
Yeah.
And what testing do you do? What treatments do you have available?
People that come into us, or they've been diagnosed with thyroid disease.
Okay.
So we're not diagnosing it at this point. We're helping with diets and stress levels. We're approaching this. We have this very holistic approach of a human being. And we look at all the biomarkers and antibodies, and we want to make sure that nothing has been missed. At the same time, we don't take anyone off medication or don't put anyone on medication. But we can, if somebody comes to us and says, "Okay, I'm ready to go more natural," we'll support somebody, right?
Right. Good.
What about adrenal fatigue?
Oh my goodness. That is so prevalent, isn't it? Incredible.
Well,
it's
people
everywhere.
diagnose themselves with it.
Well, and I know it's not really a medical term, so you've been very patient with all.
We laugh about it.
I know.
I think I have adrenal fatigue. I'm like, okay.
Yeah. Well,
I really
don't we all? We're living in this world.
I listen a lot.
Yeah.
Okay. I'm because there are, like yourself being here. We do things differently, but it's very interesting to see how other people are looking at a lot of the same issues and can learn from that. So it's always educating. Yeah. So but adrenal fatigue is something that, if you've been stressed for a long time, you're going to get adrenal fatigue, and it's hard to diagnose. But it's very important because it's not only the stress hormones, but it's a lot of other hormones, testosterone particularly, androstenedione, lot of other things that are important to pay attention to.
How do you deal with adrenal fatigue?
Yeah, and I want to hear how you deal with it too.
Are you asking me?
I'm asking her. I want to know how you deal with it, and I know kind of what we do in the office.
I rely a lot on blood tests. And so seeing a diurnal rhythm of adrenal function, trying to see what their sleep patterns are like and what basically their symptoms are. And it's if they're severe, using supplements and cortisol. And if they're not severe, often it's a change of mindset. It's the stress that's in their lives that is causing that to happen. And well, I think if I knew how to relieve stress for people, I wouldn't be just sitting here now. But I think those are the actions to take and to see what in their life is causing that issue, and arranging for them to have therapy and not to surprise you too much, but acupuncture too. So.
Well, I'm happy. I was going to say we're so aligned.
And, exactly.
It's always a beautiful surprise to find out that, we always say Western medicine and holistic medicine approach, we can really have a beautiful bridge. You can do both. It doesn't have to be one or the other. It's pick and choose what works for you, what's serving you best at this moment in life, right?
Yep, absolutely.
So what do you do?
So acupuncture.
Acupuncture.
Always. That really resets our nervous system. And that's what I do. The first thing I do, everybody gets their own custom protocol, but nervous system reset, that's the first thing that they get, the first few needles. Herbal medicine is very potent in treating adrenal fatigue. There's that concept of yin and yang, right? That are in dynamic relationship, and you balance the yin and yang. Adrenal fatigue is usually to go, in line with the traditional Asian medicine is considered low yang or deficiency of yang. And that's what we're working on, or, testosterone levels, lowering cortisol levels. And it's really amazing to see that how your body just knows what to do. You just need to prompt it correctly, right? You just have to kind of code it with points and plants and, and the patient has to be consistent. However, it works.
Yeah, I imagine it's a commitment.
It's a commitment
for the patient and the people that come to you. You want that, right? Because you're trying to help them. And if they're kind of halfway in, do you have to have those talks?
We have those talks all the time, but patients feel so much better right away. They don't recognize that, you don't need a salad and lose several pounds, right? You don't go to work out at the gym and that's it one time and you solve your problems. It's a consistency, it's determination, commitment, and, prioritizing yourself, self-care over everybody else's needs. Because I think we might be treating similar patient. It's a caretaker, it's a mother, it's a, it's a community volunteer. And, everything else is more important for her than her own self. And we're trying to change that.
The other thing that we wanted to talk about was your experience with AI.
Oh, yes. We've had such a conversation, all three of us on the phone.
Yeah.
I know.
Can we move to that?
Yeah,
now?
let's move to AI.
Yeah, because I get harassed every day in my emails about AI, right? It's just
so funny.
And the one program that you mentioned, Otter, I have looked at Otter.
Yeah.
And it was primarily for, I think, your dictation or something, I can't remember, or meetings, organizing a meeting.
Yeah.
But then you mentioned this other one that actually is like a scribe.
It's a scribe. It's to liberate clinicians, allow them to do what they're here to do, right? It's get free AI. That's what I use in my practice. And it organizes all the information that has, been discussed during the appointment, and gives you a nice layout.
So, not knowing really almost anything about it, if we had Get Freed applied to this conversation, what would that look like?
All right. So I wouldn't apply it to this conversation because it will organize into objective, subjective, all those things that are really
Okay.
targeted towards clinician,
But is that a particular program on it, or is it, or there are other ways? Are there other applications of it?
That is it.
Okay.
And that's the beauty about it. That's
Okay.
all it does. You plug it into your practice.
Okay.
For this conversation, I would be doing Otter AI.
Otter, yeah.
So it will
Okay.
transcribe
Yeah.
everything. You can go back and look at, what was said.
Yeah.
And,
It could be a blog post,
It
right?
can be a blog post.
Yeah.
Yeah. And there are other AI companies there that will give you, take this text and will give you a, social media post, a blog post, a song, right?
I know.
Anything
I know.
you need.
I know.
Yeah. We'll create.
We were kind of playing around with it the other day because we were working with on an ad for the Riv. And it was just funny because we were just putting things in there to see what came out. And he was just amazed. Like, it comes right out.
It does.
It's amazing.
It's so fascinating.
Yeah. But let's just say in a consultation, you start going into things with your patient like, like you would, like maybe personally about you, or like, I had this and what does it do with that information? Or I went skiing in Aspen, or does it?
It summarizes it. It does not record it. And you can edit it. So you go back and you edit it whenever that doesn't go into a patient file, right? You read it. Of course, you're in charge, and take the pertinent information that is really relevant to patient's visit and put it in their file. Yeah.
And then that probably just to edit that doesn't take long.
It's, it's like any document, any email, it takes a few seconds.
Yeah.
Yeah.
And you
Depends
said
how long you read.
Yeah, I know. And you said to me that by the end of this year, you'd like your whole practice to be
AI powered. Yes.
So what does that look like? What does that look like?
After the conversation, first of all, I don't think it's going to take that long, honestly.
Okay.
It's happening so fast. What does it look like? Administration costs, right? That's my biggest issue with running clinics or any healthcare. What is it? 30% of every dollar in the healthcare budget of the US goes to administration, and there's so much waste, right, in everything. So streamlining and
so how would that work for administration?
Good question. Just using AI to make things go faster, from bookkeeping to patient emails to, and, obviously when I say that, this is complementing our practices. It's not going to replace us as healthcare practitioners. We always need a human touch and a person with us to support us through our journeys. That will not go away. However, so our practice also is personalized medicine, right? Every person gets their own personalized treatment plan, their own personalized nutrition plan and supplement plan. This will only augment the speed and the amount of material and data that we can get through. Now, instead of, I can only take on so many patients, right, to do it really well and dig deep. Now we can really take on more patients
because of that scribing?
Well, no, not just because of that particular, just AI in general, what it can do for healthcare. So I'm very hopeful, I hope more people will embrace it because it's here.
So, but specifically, what is as an example of what it can do to make it so you can see more patients?
I'd love to see more patients, and I would love to spend more quality time with them instead of worrying about capturing our conversation and not being fully present. Part of the therapeutic effect of being with a practitioner in the room is so we're present and there for them.
Right, you're not
really
typing
listening to their stories,
and,
And I have a background in spiritual psychology, and one of my favorite tools that I bring into my practice is soul-centered listening, right? And that is really hard when you're trying to capture all the information from the patient.
Yeah, it really is.
Really tuning in and seeing, what is this all about? Somebody's feeling anxious. Is it about the dog that just died, or is it something else? You're able to see bigger picture.
And so with AI, let's say if it's using it for patient retention or checking in, are you using it in that way yet? Or
that's the plan, and I will keep you posted. However, my biggest pleasure is my favorite thing is to do research and keep up with the research, right? And it's really hard. Like it used to take me days to research a subject matter, right? Now, I use Scholar AI and I use Perplexity and have all the reference links, and it's all brought to me, and now I can really take my learning and my understanding of the subject matter to the next level, and it's all latest information, right? So I don't have to go to each journal separately. I don't have to go to PubMed. And remember that it's really the difference. It feels like when we were in school or college, I had to go to the library and then we had Google, right? So that's how it feels now with how you can do research and
people say that we all need to be like a very early adopter of AI, because if we don't, we're going to get, it's almost
left behind.
It's almost like when people took their, business online and got a website. If you didn't do that, you were going to be left behind.
You did not exist.
And it's true.
Yeah.
And so I think we have to get more, I do use it for lightly for different things I'm working on, content, for sure.
It's an incredible tool for creating content.
Yes, it really is, because you don't have to think about it anymore. And my daughter's in college and she's using it.
Yeah.
It's changed the way you do a paper and how, you know what I mean? The way you're learning something, you just put it in AI and then you can easily learn it because it's the way they organize it.
Yes.
Right?
Very true. And it's so much faster. And now you can really focus on what you're into, right?
Yeah.
What is, on the subject matter and really go deep into it.
Yeah. So I absolutely see that it is like Google. It's going to be that profound.
Yeah.
Yeah.
But in medicine right now, the deepest reach of AI is actually in radiology.
Really. Yeah.
And its interpretation of a very subjective situation where you're looking at imaging, and the nuances of that imaging is in the human brain is built by experience. You look at things, you go over it time and time again, and you don't even know that you're doing this when you're reading an X-ray or any other imaging technique. And incorporating AI into that has advanced that skill tremendously, particularly in the light of mammograms. It's been, and it's very common to be using that now as part of a general screening process. That's really my knowledge of it. Doing it into the workday benefits of the practice of enabling these things that we have to do every day, and saving some time with that way is very attractive. For sure. So
very exciting. I'm so happy to hear that you embrace it.
Oh yeah, absolutely. As long as it doesn't mess up his accent or mess up writing down.
It's not going to mess up the accent. It's whether the accent messes up what we get out of it. That's what you meant.
Yeah. Yes. And with yours too.
Yeah. No, well, there's something called 11 Labs where you can record your voice and then kind of pretty much clone yourself for any communication.
Yeah.
So
you've looked into that, right?
Yeah.
Yes.
Yeah. That's good.
Yeah.
More to come on that. We're going to share notes in a few months because I'm going to get going on some of this. Yeah.
I'll keep you posted.
And that's all those, particularly the SOAP note that you're referring to, HIPAA compliance, and that's written into the program.
That particular AI is created by a husband of a clinician who is very busy charting after seeing her patients, and And it is, yes, that is like closed sandbox, so it's there, it's yours to serve you.
I want to go back.
Yeah.
Thank you for that information, because that's been all of this has been educating for me today. So I appreciate it. Thank you.
Thank you.
But going back to the hormones a moment.
Yeah. Okay.
You said that when you feel the need for hormone replacement for some of your clients, you refer out.
I refer out, yeah.
Why not somebody with a pulse?
Why? Say that again. Pellets. So
I said somebody with a pulse is what I said.
So got it. Okay.
So
yeah, I see.
I mean, there are practitioners like myself in town who concentrate on hormone replacement therapy, but you choose not. Is that a cost issue for patients? Because the virtual is pretty.
Yeah. That's cheap. What they work with, virtual practitioners. Yeah,
I know.
Yeah.
I know. I'm saying, is that the reason why you use virtual as opposed to?
Is it just easier on patients to have a virtual appointment?
Got it. Good question. I don't know. I didn't realize actually that you work with hormones. I don't know how it was.
It's a huge part of my practice.
That's beautiful. Yeah. Okay. Well, we'll
send has been for. As I have grown older, my practice has grown older with me. So from being doing OB when I first came to town to very pushing the envelope and minimally invasive surgery for the 80s, 90s, and early 2000s. Now my practice is menopausal medicine and more than anything else. And actually their husbands as well, because we can get patients working well, and if we've left the husband behind, they need some help too.
Of course.
So that's something that we offer.
Perfect. So. Well, we're going to be really good friends.
Good.
Thank you for sharing that.
Thank you. Thank you very much for being on the podcast. It's been educating, and I appreciate your time. Thank you.
I'm really excited because we get patients that really ask these questions too about functional medicine, where to go, adrenal fatigue. They want to go the next step.
Gluten sensitivity.
Gluten sensitivity.
You're going to have all of our problems.
And we don't do any of that. So it's,
we're here to help.
And you're right close by. So it's really nice. And welcome to the neighborhood, by the way.
Thank you. That was such a welcome email. Thank you. I loved how you opened it. Thanks a lot. I'm so grateful to be here with you. And
we'll be working together soon.
Yes, great. Thank you. Thank you both.
Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.